Thank you all for coming. I know that I sent you an agenda for the meeting today. So if you have your devices, you can pull that agenda up. There are some handouts in the back. There's some things. We've got to do a little bit of work today, but we'll get through it. So welcome to the Livingston ISD School Health Advisory Committee. We're going to adjust the agenda just a little bit because we have, and Dr. Popat is going to speak to us a little bit. He had a little bit of time in the last meeting that we had, but he would like to talk to us about nutrition in schools. And I will let him introduce himself again to you. Let's switch this. He does have to get back to work, so we're going to give him his time up front. Thank you.
Thank you. Hello again, everyone. Thanks for having me again, and I'm going to have to present and leave. And so for those of you that were here last week, if you recall, I'd kind of presented the concept of nutrition in schools and how it's important to get these kids when they're younger and also starting to make their own decisions. And so if you recall, I said I'd come up with kind of a framework for how we would present this information to the kids. And I guess before I present this, I guess what I would ask is that if we feel this is something we want to present to the children or even the adults in the school district, if you assign me one point person that I can communicate with, that way me and that person are working on this together. And I know it's kind of late in the school year now, but maybe having a game plan ready for the new school year. That way we can hit the ground running when they come back to school. So that's what I would ask, is if this is accepted and whether it requires approval by the superintendent or their principals or something formally, then if we could just assign me one point person so it's easier for me to kind of get this off the ground here. I left one handout here at the desk, and I started to make a whole bunch of copies, but kind of the framework I wanted to kind of formalize is, and I'll just kind of read from what I prepared here. So again, my interest and my reason for doing this is the fact that we are in a healthcare system that treats symptoms and diseases but doesn't actually address the root cause. So background. Chronic condition is defined as a physical or mental health condition that lasts more than 1 year and causes functional restrictions or requires ongoing monitoring or treatment. 60% of Americans have at least one chronic condition. And in 1960, that was 6%. So we've come a long way in a bad way. Some examples would be hypertension, obesity, depression, diabetes, ADHD, for example. Chronic conditions have been repeatedly proven to be the leading cause of death, disability, and healthcare costs in the U.S. Standard practices for healthcare providers to prescribe medications or perform procedures or surgeries to control the disease or treat the symptoms. We are the most technologically advanced healthcare system in the world, yet we spend the most on healthcare in the world, but we have one of the highest rates of diseases in the world. Our healthcare system has done a poor job of addressing the root cause of almost all of these illnesses. The first question we should all ask if we have any symptom or disease is why? And so I've kind of broken it down in two different ways, and I'm sorry, again, I don't have a handout, but I can, if hopefully we can make copies at some point and get them. And again, it depends on the format. I can condense all this down into 1 hour, a semester. I could create a whole curriculum for a whole semester on this, so it just depends on how we want to proceed, but I kind of have two different outlines here. The first one is a 5-section outline, which would go, the first one I called the evolution of SAD. SAD meaning the standard American diet. And the subpoints I have there would be to introduce our ancestors and their food, key moments in people in our history that influenced our food policy, and how we got it so wrong and how we can get it right. Number 2 would be basic biology, review of important human organ systems, the gut microbiome, hormones, genetics, and the immune system, and detoxification. Section 3 would be the food industry and labels, deception, sugar and its many names, big food chemists. It's got to be cheap, quick, fill me up, and taste good. And then governmental organizations, the FDA, USDA, and NIH, and how, sorry to say, they're complicit in this whole, what I call racket. The 4 pillars of health: food and poop, sleep, stress, and exercise, and then the roadmap. It's not that difficult. Remove, then replace, the NOVA food scale, baby steps, don't set yourself up for failure, be your own detective, and common sense. So that's kind of a detailed kind of outline, but I kind of have a more generalized one, again, based on how we decide to proceed. And I have it broken up into 3 categories: why, what, and how. So why? Why is this all important to us? Why healthy is considered healthy? And why is everyone on pills? Next is what? Food, water, air, and skin, meaning the sources of our chronic disease. Sleep, exercise, and stress. And then how? Be your personal detective, understand labels, improve every day, and realistic goals. So that's kind of what I feel would be a great way to present the information. Again, I don't mind doing this for the adults, the teachers, the kids, whoever. But again, I would just appreciate someone, if we decide to go forward, the proper approvals with the superintendent, principals, and then assigning me one point person, we can formulate a game plan and maybe go live in the new school year. So I'll open it up to questions, and if anybody has any comments, I'd be happy to take them.
So we're just going to kind of talk about it and decide if we maybe start with staff.
Sure.
You would come and you would do the presentation.
Sure.
Either way that we go.
Yeah. So again, if it depends if you want it once a semester, once every couple of weeks. I mean, I can't promise I'll be available at the same time but my point is that it just depends how much time we want to donate or give me, and I can cater the program accordingly. And we can try on a bare bone scale 1 year, and then if the next year things work out, we can increase the amount devoted to this. But it just depends on how much time and who my audience would be, and then I can formulate I can turn this into a 1 hour session, I can turn this into a whole college course. So it just depends on, again, what we want out of this. So that's what I would, that's my suggestion.
What age groups? All?
So ideally, I would like it to be kids that have already had some basic biology, and I don't know what age group they'd be able to, even, there won't be anything, anything directly discussing reproductive system and that stuff. So I don't think definitely in elementary school, but maybe middle school, ideally high school kids who are already making their own decisions, who are learning to drive, making their own money, where their decisions are now theirs and not only someone else's decisions. So kind of that sweet spot where they can start to think for themselves and make their own decisions. So that would be ideal. Again, that's just my perception.
Any other questions?
Okay.
Okay.
So I'll just, thank you very much.
Thank
Appreciate
you.
it. Okay. I'm going to head back, but sorry, shameless plug. I'm at the clinic. If you guys want to come by, take a look around. I'm working there today, so we're right near HEB. So no pressure. Just if you want to come by, come and I'll show you guys around. Okay.
Thank you. Thank you for your time. Okay. Thank you for allowing us to make that adjustment. I know we were trying to figure out how to get him set up via Zoom, and that didn't work out. And we are having technical difficulties, so I am glad that I made copies for you this morning so you can follow along. As we'll go ahead and back up a little bit and start the meeting. I know we are supposed to read the minutes from the last meeting. And I do have those to project for you, but they are 6 pages of the minutes of the meeting. So if you have a device and you can pull that up on our website, it's posted. Jennifer is always very gracious to take those minutes for us. We covered a lot of things in the meeting. So it just basically lists, the meeting was called to order at 9 a.m. It lists those in attendance. We met on November the 15th, 2023. I'm just going to hit the highlights. We spoke about ripple effects, that we're implementing the modules now. We started out with the Bouncy program, and now we are moving on to the modules that students can select. Teachers can utilize it if they're dealing with a specific behavior. We had our coaches here from all campuses. They presented and shared about the fitnessgram that's currently ongoing on their campuses, and the different ways that they implement it to make sure that those students are participating in it. We also made it known that parents can always request a copy of the fitnessgram. If they would like to have one, they just need to get with the campus and request it. It lists all the coaches. We also talked about bully reporting, recess guidelines. I always talk about the Friday Beat, the newsletter that the coaches have access to implement, or it keeps them updated on current events on health in school and activities. We talked about T-Chat as well, and how that's being utilized on the campuses. We actually have a representative from T-Chat that's going to be at our next meeting, so that I think she would do it more justice to do a presentation for you to talk about all of the steps that T-Chat includes. And I did run that report for our district. We've currently, at this point in the year, had 51 referrals to the T-Chat program. And so it's being utilized, and we're able to support students with whatever they might be struggling with through that program. So she'll be here at our next meeting in May to kind of discuss that with you, and we'll be closer to the end of the year so we can give you a more updated report on how that is actually being utilized on the campuses and to what degree. Our food service department did a wonderful presentation on student food allergies, and we talked about the new food allergy plan and that's being utilized for our schools, and that we have available to our parents, so that we can make sure that we're addressing any allergy needs that students have. We talked about the teacher meal program that they're having on Fridays. That's new this year. And we talked about the hands-only CPR course. Is Coach Justice, is she here? I don't see her. They're here to help. I just needed to project. So she's using, do you need the computer? Coach Justice was talking about the hands-on CPR class that she's doing with her students here at Creekside. And I know that we also offer that at the secondary level too as well. We talked about the standard response. Are we up? Yay. That's it. You want to come back and show me what you actually did? Okay. We talked about the standard response protocol. That's something that Dr. Hawkins has asked that we have a lot of conversations about in the district, so that we're all using the same terminology. So we reviewed that. That is available to our parents and our students, our staff online. They can review that, whenever they need to. We took a look at some of the safety. Is that? Mine's blinking. Some of the safety links that we have on our district website, the Alert Me Polk County and the iWatch Texas, that can be utilized by parents, students, staff. Dr. Popat gave a brief introduction and introduced himself, and that's why he wasn't on the actual agenda last time. So we did invite him back to give him a little bit more time to share his vision of what we could possibly consider offering to students and staff. We talked about he talked about the American Heart Association and heart disease. He suggested that he might be able to visit biology classes. I did speak with him and let him know that would have to come through the Shac committee, and also through our curriculum department to make sure that it was aligned to the TEKS. And then our life skills teacher, Ms. Foster, was here, and she was able to share some updates for the Best Buddy activities that's taking place on her campus. And she reminded us of some dates that were listed there. So it is 6 pages. It's on our website. You can go through and read it. If you have any questions or about that, or if you were not able to attend and have any questions, just please reach out to me, and I can answer those for you. So the first thing that we have to do today, every 3 years, we have to review the district wellness policy. So I made a copy of that for you. If you didn't get one, they're in the back. And we have to review the LISD wellness policy assessment tool, which this is our 3rd year, so we do have to take a look at that document as well. The Shac committee does have input into that. So I'm just going to go through, and if you have the wellness policy, I'm just going to hit the highlights, tell you what the wellness policy is, and then we'll talk about the goals and the objective for each goal and the action steps. There's a lot more detail in this document, so it may be something that we can put on the agenda next time once you've had an opportunity to review it again. If you haven't already, then we can certainly answer those questions the next time. So this document, referred to as the Wellness Plan, is intended to implement policy FFA local, which has been adopted by the board to comply with the requirements for a school wellness policy. The district's local school health advisory council, Shac, will work on behalf of the district to review and consider evidence-based strategies and techniques to develop and implement nutrition guidelines and wellness goals required by federal law. So basically, as a committee, we're going to review each goal and objective, and if there's anything that the committee feels like we need to address, add, take away, if there's any new strategies that are being implemented now to reach those goals, excuse me, and objectives, we can have those conversations as we go through them. Federal law requires that certain stakeholders be involved in the development, implementation, and periodic review and update of the wellness policy. The Shac will solicit involvement and input from parents, students, the district's food service provider, physical education teachers, school health professionals, board members, administrators, and members of the public by social media posts and district website announcements, yearly recruiting flyers per campus. And we do maintain a document on our website under the School Health Advisory tab if anyone is interested in joining. And periodically we receive emails of community members and reaching out to us to be a member of Shac. Responsibility for implementation. Each campus principal is responsible for implementing FFA local and this wellness plan at his or her campus, including submitting necessary information to the Shac for evaluation. And we do that through, an example would be our last meeting. We allowed our coaches from each campus to give input and talk about what was taking place on their campuses. Our counselors are involved in these meetings and provide information to report out to you. Our nurses are here at each meeting, and they're able to report out to the committee that information. So goals for nutrition promotion. I'll let you read through that. We are required by federal law to establish goals for nutrition promotion and the wellness policy. And the Shac is required to monitor this through quarterly reports from Food Service Department on the number of student participants, comparison charts of advertisements, and the Smart Snack standards developed by the Food Service Department. And they were here and presented, they had a PowerPoint that I thought was very informative. You can go back and look at that. We record these meetings now because we're required to, so anybody is welcome to go back and listen to that presentation. I don't know what's making that blink, so if it's me, I do apologize. So implementing goals for nutrition promotion on page 2. That goal is the district's food service staff, teachers, and other district personnel shall consistently promote healthy nutrition messages in cafeterias, classrooms, and other appropriate settings. The first objective, the district will continue the free breakfast and lunch programs to all students. And the action steps, utilize online menus, Facebook posts, cafeteria signage to promote programs and healthy nutrition. And so we are doing that. I know that our nutrition department has their own page as well, and they promote that. And all of those things are in place. Objective 2, encourage campuses to participate in national nutritional programs. And I think that's done in a variety of ways on campuses. And the action steps is meet with campus PE teachers and coaches to introduce options. And so that's why, if our coaches ever wonder why y'all are always invited to these meetings, you're an important part. So thank you for being here. Goal 2, the district shall deliver nutrition education information that fosters the adoption and maintenance of healthy eating behaviors. The action steps would be maintain Shac link on the district website with updated resources, as well as posting the DSHS Friday Beat on campus web pages, and we are currently doing that. Objective 2, post monthly breakfast and lunch menus on district and campus websites, including nutritional information for each meal. The action steps, LISD Food Service Department will develop menus that are in compliance with this objective, establish links to menus on campus websites, and we are doing that as well. Goal 3, the district shall ensure that food and beverage advertisements accessible to students outside of school hours on district property contain only products that meet the federal guidelines for competitive foods. Objective 1, 100% of the exterior displays on vending machines available for student use during the school day will be Smart Stack compliant. We do not have vending machines available to students, so and we talked about that in several of our meetings. Goals for nutrition education. On page 4. Beginning on page 4. Implementing goals for nutrition education. Is that a duplicate? No. The district shall deliver nutrition education that fosters the adoption and maintenance of healthy eating behaviors. Objective 1, at least 90% of high school students in each 4-year cohort will complete 1/2 credit of health education as an elective. And that is currently in place and has been for many years. Goal 2, the district shall make nutrition education a district-wide priority and shall integrate nutrition education into other areas of the curriculum as appropriate. Objective 1, campus and district staff will promote and integrate nutrition education activities at a minimum of 5 events per year. I know that we have in the past held our health fairs, and we, of course, COVID intervened in that, and so that is something that I've had several requests that we consider to continue that or to start that program back up again. So that is something that the Shac committee can help decide and help decide, what we want that to look like and put that back in progress. Goal 3 on page 5. The district shall provide professional development so that teachers and other staff responsible for the nutrition education program are adequately prepared to effectively deliver the program. Objective 1, the district shall encourage teachers to integrate physical activity into the academic curriculum as appropriate. After staff development, at least 60% of teachers who respond to a survey will report that physical activity breaks were regularly incorporated into their lessons. And so to my knowledge, we have not conducted a survey, so that may be something that we need to implement this year to make sure that we are reaching that objective. Action steps, determine appropriate days in which teachers will receive staff development related to the importance of physical activity breaks. Goal 4, the district shall establish and maintain school gardens and farm-to-school programs. I just actually spoke with, and Dr. James, you may need to help me out. There's a program currently on your campus. Do you remember the name of the program? It's an outside organization. They're coming in, they're utilizing the raised beds on Memorial Walkway to create pollinator beds, I believe is the correct term. So that is taking place on some of our campuses, and we have some organizations that are working, through our students, the programs, and on our campuses to make that happen. The district shall establish and maintain. Oh, I read that. So the next one is goals for physical activity. Implementing goals for physical activity. Goal 1, the district shall provide an environment that fosters safe, enjoyable, and developmentally appropriate fitness activities for all students, including those who are not participating in physical education classes or competitive sports. And I think if you just you hop on to their pages that they maintain, you'll see a lot of those activities that are happening. And I appreciate all of our campuses and our coaches and that are, helping to get that information out there and let everyone know all of the physical activities that are taking place on the campuses. Not just jumping jacks. They do a lot. Objective 2, the district will incorporate fitness for all students, grades 3 through 12. We are doing that, and that, like I said, if you weren't at our last meeting, the coaches did a remarkable job of discussing that program and what it looks like on their campus. Goal 5, the district shall encourage parents to support their children's participation to be active role models and to include physical activity and family events. Objective 1, the district will promote at least 2 district-sponsored wellness events that are specific for students and their families. And I know that we've done the fun runs that they can participate in. Can anybody else think of anything that you want to share that your campus is doing?
CSC does the parent tailgate party out here, and they always include the wellness representatives in the community.
Okay.
That are interested in participating.
I'd forgotten about that one. So Creekside Elementary does their own mini health wellness fair here on campus that their parents are able to be involved in. Goal 6, the district shall encourage students, parents, and staff and community members to use the district's recreational facilities such as tracks, playgrounds, and the like that are available outside of the school day. Goals for other school-based activities. Implementing goals for those. Goal 1, the district shall allow sufficient time for students to eat meals in the cafeteria facilities and the facilities that are clean, safe, and comfortable. Objective 1, district campuses will build their master schedule to allow for at least 10 minutes to eat breakfast and 20 minutes to eat lunch from the time the student receives his or her lunch. So that does not count the time that they're standing in line to receive it. Goal 2, the district shall promote wellness for students and their families at suitable district and campus activities. So if that's happening at your campus, let us know. Report that information back to the Shac committee so that we know that we're meeting all of these goals and objectives. On page 10. Goal 3, the district shall promote employee wellness activities and involvement at suitable district and campus activities. Objective, the district will utilize its health insurance provider to encourage wellness by communicating the preventative services covered at 100% during each enrollment period. This should include district vaccine clinics to support wellness. We've met those goals and that objective. We offered the vaccine clinic to our staff. And I know that some campuses are doing healthy activities for their staff to promote wellness. Some of them are competitive and some are not, so it just kind of depends, what the campus is doing. I think that is it for the goals. I can open this up for discussion. Does anybody have any questions about the goals and objectives and the wellness plan? Do you need some time to review it? We can certainly put this back on the agenda, and I can open it up for questions at our next meeting. And absolutely, we are asking our campuses to report back to the Shac committee about things that are taking place on their campus. So if there's anything in here that we haven't already covered in our meetings, just if the principals will let me know, we'll certainly get that on the agenda so that the entire committee can hear about that. The other document that you have is the Wellness Policy Assessment Tool. So now that we've gone over that, speaking of physical activities, anybody need to stand up and stretch, move around? We do have an assessment tool. The last one we conducted with the Shac committee on November the 8th, 2021. So we'll run through that real quick. This is our third year, so we will need to complete this assessment again. We're not on any particular timeline. I know that this is, if you haven't already been exposed to the wellness policy, that's a lot of information. And so we can certainly put these back on the agenda once you've had an opportunity to review it and open it up for discussion again. The template that you're looking at identifies our district. It just asks basic questions. Public involvement. We encourage the following to participate in the development, implementation, and evaluation of our wellness policy. And I've checked the boxes. We have all of those on our committee that are all involved, able to provide input, make suggestions and recommendations on this committee. We have a designee in charge of compliance. We make our policy available to the public. We measure the implementation of our policy goals and communicate results to the public. All of the tools that we use to do that are listed there for you. In our district reviews wellness policy at least once annually, so that is what we're doing today. Nutrition education, our district's written wellness policy includes measurable goals for nutrition education. We offer standards-based nutrition education in a variety of subjects, science, health, math. We offer nutrition education to students at all campus levels. And then nutrition promotion. Our district's written wellness policy includes measurable goals for nutrition promotion. We promote healthy eating and nutrition education with signage, use of creative menus, posters, bulletin boards, etc. We have reviewed smarter lunchroom techniques and have evaluated our ability to implement some of them. We place fruits and vegetables where they are easy to access. We ensure students have access to hand washing facilities prior to meals. We annually evaluate how to market and promote our school meal programs. We regularly share school meal nutrition, calorie, and sodium content information with students and families. We offer taste testing or menu planning opportunities for our students, and we actually have a chef program. That's not the right term. What's it? Roving chef. I couldn't remember that one. A roving chef program for our students to participate in. We participate in farm-to-school activities and/or have a school garden. We only advertise and promote nutritious foods, beverages on school grounds. We price nutritious foods and beverage lower than less nutritious foods and beverages. We offer fruits or non-fruit vegetables, and we have snack bars and a la carte. Has any of that changed? Okay. We have nutritional standards for foods, beverages served at school parties, celebrations, events, etc. We provide teachers with samples of alternative reward options other than food or beverages. I don't know that we do that, so that's why that is checked no, so we may need to revisit that. We prohibit the use of food and beverage as a reward. Principals may need to talk to that. I mean, I know that we've had popcorn parties for different activities, so I put no on that one. Our district's written wellness policy addresses nutrition standards for USDA reimbursable meals. We operate the school breakfast program in the classroom, and we also have a grab and go at some of the campuses. We follow all nutrition regulations for the National School Lunch Program. We operate an after-school snack program, not to my knowledge. The only thing I could think of is if we do something like that during tutorials.
We used to send stuff home.
Is that like the backpack program? Okay, right. We operate the fresh fruit and vegetable program. Debbie, are you familiar with that?
We have a dinner program, so that is not a snack program, that's a dinner program, so we probably need.
Dinner?
We have a dinner program at the junior high.
Okay,
So we probably need to change that.
okay. So the thing is recording, so I'm going to repeat what she says. They have a dinner program at the junior high. So for on our next evaluation, we can adjust that and repost. We have certified food handler as our food service manager. We have adopted and implemented Smart Snacks nutrition standards for all items sold during school hours, including a la carte offerings. Physical activity, our district's written wellness policy includes measurable goals for physical activity. We provide physical education for elementary students on a weekly basis. We provide physical education for middle school during a term or semester. We require physical education classes for graduation. High schools only. We provide recess for elementary students on a daily basis. We provide opportunities for physical activity integrated throughout the day. We prohibit staff and teachers from keeping kids from recess for punitive reasons. Teachers are allowed to offer physical activity as a reward for students. And if we need to change that, I don't know, more so at the elementary campuses, withholding recess. Do we do that?
We still use lunch and recess detention.
Okay. We offer before and after school physical activity, and that's through competitive sports. Our district's written wellness policy includes measurable goals for other school-based activities that promote wellness. We provide training to staff on the importance of modeling healthy behaviors. We provide annual training to staff on nutrition and physical activity. We have a staff wellness program. We have school district staff who are CPR certified, and that's ongoing. I know, is Janelle here? Hey, Janelle. She's the nurse at the high school, and she is our certified trainer for our district. We actively promote walk or bike to school for students with safe routes to school or other related programs. We have a recycling environmental stewardship program. We do not, to my knowledge, but I have had an outside organization that's reached out to us that would like to implement that program to us.
You're doing something recycling.
We have Polk County has done the recycling. Actually, was reached out through our PTO that we're doing something with that.
Is that with the grant too? That they're okay? That's the same one that's reached out to me. So
We just now are on
Yes.
the side of it.
You got your big blue canisters over there.
Yeah, we do.
that's the same organization that reached out to me too as well. And so, bless you. So we'll be able to adjust that for this assessment. We have a recognition reward program for students who exhibit healthy behaviors. Do we have that? The minds are turning. Okay, well, we can always revisit that.
I mean, we have like PE students of the month on our campus. Something like that. And it's the two hobbies.
Well, that's a healthy behavior, exercising, so we can adjust that for this new evaluation. We have community partnerships which support programs, projects, events, and activities, and we do have that. Additional wellness practices, and I've just listed some. I can we can add to that. If there's anything else that's happening, coaches or nurses, if y'all are doing anything on your campuses, principals, that we can add to that list of what we're doing so that it shows, basically what we're doing to meet the goals and objectives of our wellness plan. Okay, so I will we'll go back through and readjust the policy assessment tool to reflect the new activities that are apparently taking place on our campuses, so that it's more reflective of what's currently happening. Any questions, comments? I'm sorry I read to you, but we do have to go over those as a committee. The next thing on our agenda, we wanted to have open up discussion for fentanyl awareness. We have on our district website, we have the One Pill Can Kill. We have a lot of information on there. We have shared that on social media. We were wondering if we need to do more as far as like presenting. I don't know why it's blinking. There it is. There's a brief PowerPoint on here that lets that parents can access to know the dangers of fentanyl and the rate at which it is escalating, and just basically that as a district, we want to at least consider what else we can offer, whether it's in the form of this is a drug emoji code that we've posted for parents to access. They have taken emojis and turned them, to mean something else. A lot of times, even parents that are, trying to be proactive and looking at text messages, sometimes if you see emojis like this, it might open up a conversation. That's really all we're saying. I think that it's important to provide parents and students and teachers and our staff with the tools that they need to make them more alert as to what's going on around them. Are there any thoughts or on how we might proceed? Whether it's a presentation to students, how do we educate them? How do we educate our staff?
I went to a Region 6 training several years ago, and I was looking it up. The speaker, his name was Jermaine Galloway. It's called, his motto is "Tall Cop Says Stop." I believe he had a prior profession in with police department or whatever. I can't remember his actual background on what all he did, but at the presentation at the Region 6 Center, he spoke about like hidden meetings like you were talking about, and then also different paraphernalia, that gear, hats, and stuff people can wear where they hide stuff. And it was really eye-opening for me of all the bad things that are out there, and just kind of made us aware of what to look for on stuff. But as far as all English presentations, it was really good.
Does he speak to students?
I
Or
don't know, but I just typed in "Tall Cop Says Stop" and this came up. Jermaine Galloway.
Tall cop?
Tall Cop Says Stop.
Tall cop said stop.
Says stop.
Okay.
His name's Jermaine Galloway. But he put on a really great presentation, and that was several years ago.
Okay.
What he's actively doing now, I'm not sure. But it was
Okay.
really good.
Going back to Region 6, I went to a session back in the summer, and they provided me, because I'm unaware of the whole vaping and all that, but he really took into detail. I know this is not necessarily fentanyl, but fentanyl was included in that. But all the different types of vaping, what it does, the effects. It went into the dab pens, and it was really education for me. I mean, I know I'm on the primary end, but unfortunately we do see that. But for those of us that aren't, aware,
Okay, so Region 6 might be,
That website he has is tallcopsaysstop.com.
okay.
They didn't come
Well, thank you for sharing that. Yes?
Echoing what he said, he spoke at our coalition up in Lufkin luncheon. I wasn't there, but just heard yesterday. He was amazing.
Yeah.
His presentation, it was $5,000 for our charge to speak. So
Okay. So he speaks mainly to adults then? I mean,
Yeah, it
or
was,
it's not, he doesn't,
community presentation.
Okay.
100, 125 people there at the luncheon.
I
But
think Blackburn and some of them were.
did they?
I think so.
yeah,
Okay.
But everyone loved what he said. It was, I didn't see it, but
And he had,
hearing what they said about it.
he had a big display on a couple tables of different type of clothing items and how different vapes can look like, things that you wouldn't expect, like maybe just all kinds of things. He had visuals and just talked about signs and cues to look for and stuff.
So,
So does he talk about fentanyl? Or is he just strictly vapes and,
Whether he does or not, I can't recall on that, but, I
Okay.
think it's, can you remember?
I'm sure he
I bet he
does.
does. I bet he
Part of it,
does.
but Kratos, a lot of they call it gas station heroin, and he has all these things to look for that are sold because they're not regulated. And
okay.
but
So it's more of an all-inclusive. He talks about several things. Okay. Ms. Murphy?
I was gonna say, I talked yesterday with, the adult meth with me, which I know is mostly meth, but they're coming back, they're gonna do individual campuses, they're working that out with us this year. So I already scheduled a date for them to come to talk to our fifth graders, which is only the fifth graders, but, I'm with Ms. Vandiver, and as you know, it's reaching down into elementary, more and more every year. And I think our elementary staff, though we do pay attention, but now it's like first and foremost. And it's not only affecting, because now that the state laws have changed, it's affecting instruction as well, because these kids are sitting in a ISS or a DAP while we're trying to help them. Nothing can take the place of them being in the classroom. So, and a lot of our parents have been surprised. They're like, what? Yeah, that's,
We have teachers that don't even know what a vaping device is.
Right, they don't.
right. Because if we don't vape, or if we're not around it, we're not used to picking them up off of kids, so it's been a whole learning curve. So do I think, and even if we don't bring someone in, I think our school resource officers are a great resource we could also use. If they've been to somebody else, then maybe they could work up a presentation. Maybe it would even mean more, because they have a relationship with our kids.
Right.
Just a suggestion.
Okay.
I do think it's needed, and maybe they can contour it to our elementary as well. And I think that those are two different maybe three different conversations, the high school, elementary, and middle school, but yeah, take that.
I know Blackburn used to do one when Kevin Ward was still with us at the junior high. They teamed up and did a presentation for the staff.
For
For
vaping or
vaping, everything.
everything? Okay.
Because back then they had an update every summer, and they brought the information to us, so we knew what to look for in junior high.
But I think those updates are good for everybody because those disguises that the vapes and how they're changing every year. It's even hard for us that see them every day. They're always coming up with something new.
Mm-hmm.
And the kids have it right in front of your face and you don't. It's hard to
Well, the trainings that I've been through, they recommend that you just do a search on vapes or at least every 3 months because they'll change. They change that quick. And that as well as the different ways that, students are disguising them, So it sounds like we need to start with educating with educating our staff first, especially at the elementary levels. And then work our way to students and parents.
And probably maybe a yearly thing because of the change, the way it changes and looks.
Okay. All right, any other questions? Do we have any community members that are here that would like to talk to us about upcoming events that you're hosting or any information?
I want to
Yes,
share
ma'am.
some information. My name
Wait, let me get you the.
My name is Reina, and I work with Community Health Choice. And we're a nonprofit insurance company, and one of the things that I do is I'm a navigator with the state, so I help people apply for like state benefits. I am here in Livingston the second Wednesday of each month at Our Father's house. I can also do the assistance over the phone, so I can help any parents that have children that don't have any health insurance apply for like Medicaid, CHIP. I help them apply for food stamps. Young women, I help them apply for the Texas Healthy Women's Program. And for older adults, I help them with the Medicare Savings Program. And if they don't get me here in Livingston, like I said, being a navigator, I can do the application assistance over the phone. Thank you.
Thank you. Anybody else? Okay, that is all that I have for today. Thank you so much for coming.